my name is Abby Ponder. I'm a junior, and I'll be checking Ruben off on musculoskeletal.
Hello, I, Andrew Mascara, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as a part of Nursing 210 Adult Health Assessment and Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secure YouTube site viewable by nursing students and instructor of the course. I understand that during this examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent.
Thank you. Hi, I'm RubenCarlo, student nurse here. Nice to meet you. Could you tell me your date of birth?
December 29th, 1995.
Nice. And before any assessment, I would practice good hand hygiene just to promote good quality health care as well as the prevention of diseases. So today we're going to be assessing your musculoskeleton, and let's begin with, actually, can you stand up real quick? We'll just begin with that, like your lumbar or your spine. So before we do that, could you stand right here and walk here to the other side of the room? And on the way back, just go ahead and stop in the middle. Okay. So upon inspection, I can see that his gait is normal. He has an upright posture. If you can actually just go ahead and touch your toes and inspect your spine. Good. So the spine is straight. There's no lateralization. There's no deviation in the lumbar area. You can go ahead and stand up. Good. And then also before you sit down, just so for the sake of time, if you can abduct your hip away from the body, and then abduct. And, there you go. And go ahead and have a seat. And just to further inspect for adduction, go ahead and sit like a woman. There you go. And then cross your legs. And I'll do this bilaterally as well. So let's begin with the cervical area. I can see that just throughout his body, his muscle tone looks good. I see no drooping or any signs of atrophy. Usually with a hypertrophy, you would see like a mass or like a drooping kind of look. But everything looks good. There's no, I'm going to inspect your muscles. Actually, yeah. And I'm going to do this again as I go down from this upper and lower extremities. So I didn't feel any nodularities. Let's begin with the cervical area. So Drew, I'm going to ask you if you can look down and then up, and that's flexion and hyperextension, and then lateralization, left and right. Good. And then look left and right. So this is okay. Good. And I'm going to ask you to do this upon resistance. Good. So flexion, extension. Go ahead and look to your side. Good. So I'm assessing the sternocleidomastoid, and look at me and then go side to side. Good. Okay. And if you can open your jaw and clench your teeth, and you just did that. Good. So usually there are signs of crepitus in the jaw area, the mandibular jawbone. Same with the lower extremities and even upper extremities. And that's totally fine. Let's go down to the shoulder. So I did already palpate, but I just want to double check. Just on the arms, muscle is firm. It's not too hard. It's not soft. No signs of atrophy. For your shoulders, can you abduct, I'm sorry, and then adduct, and go across your arms, and could you hold out your hands in supination position? Good. Pronation? Good. Okay, let's do that with resistance. So abduct, I'm sorry, and then adduct. Good. Awesome. And then for your elbow, I want you to flex your biceps. This is the flexion of the elbow. Good. And then go ahead and extend. Let's do that upon resistance. Good. All right. Awesome. Okay. And now for the, let's do the wrist. So go ahead and hold your hands out. And I want you to flex your wrists. Hyperextend them. Good. Hold them out. And we're going to go on to the fingers as well. Flex your fingers. Actually, put them into the fist. Go ahead and hold your hands out. Abduct. So fanning them out and then adduct. All right, and let's do this upon resistance. So go ahead and hyperextend your fingers or your wrist. All right, flex. Same with the fingers. Try to put them down. Oh, sorry, the other way. There we go. Down. Okay, and I want you to grab. Oh, yeah. So go ahead and squeeze my fingers. Good. And I want you to squeeze his fingers as hard as you can. Good. So he has a good grip. All right. And for this muscle coordination, I want you to touch every finger and then touch the base of your pinky. Good. Awesome. Okay. Let's go to the knees. If you can go in the supine position on your back, just lay there. All right. And I want you to bring your knee to your chest as much as you can. Okay. Good. Just a flexion of the hip, and then go ahead and extend back. Let's do that again with resistance. Good. All right. Now this time I want you to go and flex your knee. So there you go. Go ahead and flex your knee, and then go ahead and extend it. All right, and let's do that with resistance. So there we go. All right. Now go ahead and extend. And I want you to raise your whole leg. Keep your leg straight and extended. You're going to go down. Let's try that again. And then go ahead and raise it. And down. Now let's do that with the resistance. Alright. And down. Good. Let's go with the ankles. So if you can dorsiflex, so bringing your toes towards your face. Okay. And then plantar flex like a ballerina. Good. And I want you to fan out your toes. This is abduction. And then going back together. Adduction. Inversion, so get the soles of your feet, try to point them towards each other. Good. And then away. Eversion. Good. And I will palpate every interphalange, the intercostals, metatarsals, and I feel no nodularities, no calcifications, no signs of edema, and this is all in normal findings. All right, you can go ahead and sit over. Thank you. And this concludes my assessment. My patient shows to have very good muscle tone. Again, no signs of crepitus, no atrophy, and he has maintained a good lifestyle. So, thank you.
Sorry, I can't see it.